So next I just want to touch on empowerment and a couple of areas in mobile technologies can be used around empowerment. Firstly, definition of empowerment. I think the second part of that phrase is really important, the capacity to transform choices into desired actions and outcomes. And I think that's absolutely vital. I mean, I know, from my background, people go on courses, so it could be farmers go on an agricultural course, for example, or young people come into a setting to learn something. They then want to go back and try out what they've learned. And it's really important when they go out and try those new behaviours out, like new knowledge out, that they get support ongoing. They don't just go to the training session and then they get no follow-up. So the follow-up is really important. And from some work that we've done in South Africa, we developed a sort of three-element model of empowerment where technology can work in each of these areas. So first is information and education. So yes, you need to do that training. People need to get the information. They need to be educated that there are choices. Then, as I say, they start trying those choices out, and they need support as they're doing that. So coaching and mentoring is absolutely vital. It's often the missing link. People do a training session, or they give people information, they come back a year later, and they go, nothing's changed. People are still using the same fertilisers they were, which are damaging the soil, and nothing's changed. Actually, if they're getting mentoring, getting support as they're trying that out, and when it doesn't work, actually somebody says to them, have you tried doing it this way? Giving them encouragement as they go along. That is a really important element of getting that successful change. And lastly, community and social engagement is really important. So we need to be engaging with the community to change things, maybe situations around HIV, for example. The social stigma of HIV is something that needs to be covered at a community level, not just at an individual level. And where you get all three of those come together is what we term change space, really. And it's where people are then empowered to be the change they want to see, which I think is a quote from Mahatma Gandhi. So we've been involved with a project in South Africa, which was the world's first mobile counselling service. They had a number of different issues there. So they had a lot of violence fueled by drink and drugs and gang culture there. There's immense pressure on local health services for drug counselling and for advice and support. And the local authorities just couldn't keep up with the demand. But we realised that people were using mobile phones. They were very familiar with mobile technology because that was the way they found out where the next drug job was going to be. So let's use the technology that people are familiar with to try and reach them and support them. And what was developed, this is a screenshot of the mobile phone. So what was developed was a mobile portal which firstly gives a layer of information. So you can see that's what substance abuse, HIV and AIDS. So this is national in South Africa. So Cell Life, you may have heard of Cell Life in South Africa, which is a national HIV counselling service, uses this platform, and a service called DAS, which is a drug advice support service, uses this platform now there. But more importantly than just giving people the information, it's got a chat box at the bottom there, so people can actually engage with a counsellor via instant message chat. I don't know whether you use Facebook and you've got your friends on Facebook. You perhaps my kids are terrible in the evening, they're watching TV, and I'm trying to chat to them, and they've got a dozen conversations going on Facebook with their friends as well. Well, the counsellor on the other side can manage multiple conversations in the same sort of way as you might do on Facebook through this, so people can get real conversations going. And I think one of the interesting things is, particularly with young people, they're actually more open in sharing information where they're not having to look somebody in the eye and they're not being made to feel maybe uncomfortable in a clinic. And in this way, they'd be much more open, and it gets them moving along on their journey than maybe it was to try and get them over that barrier and get them into a clinic from day one. They'll get there after they've gone through that process and built up some rapport using instant messaging by their mobile phone with a trained counsellor. It's been very effective. This service now has over 5 million interactions in the last 18 months since it was launched in South Africa. And it's also being now used by the World Health Organization for disaster preparedness in Indonesia.